Thank you, Viola. And good morning, Minister. And I want to thank the Rural Independent Group, for bringing this motion. And I'd also like to pay my sympathies to Deputy Michael Collins on the loss of his nephew. Where to start, Minister? The reality is that we have a very serious problem within our GP sector and within rural Ireland in general as regards the provision of healthcare. Our GPs don't feel supported. We've heard it a number of times. I noted Minister Butler's comments this morning in relation to the amount of GPs to come over the next 3 years re-qualifying. There is no guarantee that those GPs will enter our system. We've heard these figures quoted in relation to An Garda Síochána, in relation to our teachers, but we don't seem to be able to recruit them when the time comes. So I'd ask that there is some scheme or incentive put in place, such as the UK, where I have mentioned this before. The UK, when GPs or dental practitioners undertake their training, they sign up for 2 years to the Public Health Service. And they do 2 years mandatory service within the Public Health Service before they escape the country for their fling of travel or whatever it is. But we need to consider something seriously, that we can recruit all of the GPs that are qualifying. I'm very discouraged by something I received in the post from a dentist. It is a bit of a letter of hope from the department. And we all know that prevention is better than cure, and any GP will tell you that dental care is the essence of anybody's entire health. And if they haven't got a dental practitioner or they aren't looking after their dental health, then they are likely to be sick in general. But this is a letter that went out on the 31st of January, and it says, "Dear Dentist." I'm not going to read it. I'm going to ultimately read the last paragraph. "We regularly update the lists of dentists which we provide to medical card patients." And it goes on. "As outlined in the dental treatment scheme, it is difficult for patients if we are providing them with a list of contract holders who are not actively involved in providing care under the scheme. I hope that you will reconsider accepting new patients under the DTSS so as to maximise the opportunities for medical card holders to access the care they need." And a note that followed said, "Dear Verona, this reflects the attitude the HSE has towards the dental profession, which has led to the mass exodus from the scheme in recent years. Whilst the fee structure reflects charges of 15 years ago, the reality is most dentists are reducing their exposure to these schemes with a view to exiting at the earliest opportunity." Now, I'm sure you share my concerns with that. I have people who come to my office because they need a hip replacement, but they can't actually have the anaesthetic without having the all clear from the dentist, and because they are new medical card patients effectively, they don't have dentists and they can't get appointments. And quite often I have gone to the actual dentist and asked myself if they would undertake to see the patient so as that they could have the more serious healthcare treatment. This is going under the radar entirely, and it's predominant in rural Ireland towns. And I suppose with GPs, it's villages. I also am from the Hook Peninsula. It's very difficult for a GP to get a replacement, to undertake holiday care or anything like it. And I'm not going to start about my CDNT and CAMS because my colleague is going to speak, but we could have 10 debates on this. Thank you.